Hello everyone. Very good morning. Myself, Mohammad Abdul Khan. I am a PhD student uh, in Guangzhou Institute of Science and Technology. My advisor is Professor Yan Chang. Today I will present my research work. The title is Novel Rodent Model of Neuropathic Corneal Pain, a new efficient method for studying neuropathic pain. First of all, I want to shine some background about the neuropathic pain and neuropathic corneal pain. Neuropathic pain is a somatosensory pathways in the peripheral and central nervous system which have some damage aspects. While the neuropathic pain in the eye have two aspects, one is whole eye which is ocular and one is only on cornea which is called neuropathic corneal pain. So I'm going to study this part, and the symptoms of the neuropathic corneal pain is the hyperalgesia and allodynia and some kind of discomfort, burning, irritation, dryness, and creatinine. So these are the occlusal sensory path. The first neuron from the cornea, when we give stimulus, it reaches to the trigeminal ganglion, and second neuron went to the thalamus, and finally all changes happen in the somatosensory cortex. So this is a brief aspect for ocular sensory pathway. Second one is about the trigeminal ganglion and the role of satellite glial cells. So when there is any kind of axon injury, the trigeminal neuron execute nociceptive signals and which leads to central sensitization, allodynia, and pain. So when after that there is increase in neuron glial cell interaction, which makes the trigeminal ganglions for peripheral sensitization. So the final background is about the existing neuropathic corneal pain animal models. While I am developing a new kind of a novel neuropathic corneal pain, so I just went through all the existing and the most accepted model of the neuropathic corneal pain. So here are some are the surgical models, some are the laser model, and some are the chemical model. So the most accepted one is the ciliary nerve ligation by Yasir et al. They perform lateral conjunctival to ligate the ciliary nerve, and so there are the advantage of this, but the disadvantage is about it's a very complex surgical techniques and demands greater skill, and it's not easy to ligate the ciliary nerve because the ciliary nerve is very thin and it's very difficult to ligate them. And in second model, the for the by their inferior the acute stage is not possible because the surgical steps for the acute stage, when the changes happens, it already goes to the in the chronic stage, and also the surgical is very difficult. And for UV, there's a damage in the corneal nerves, and the first stromal suture, the only lymphogenesis related disease can be studied, not whole neuropathic corneal pain. And finally, for the chemical chain, there's a destruction of whole nerve ending, and which can activate the abnormal immune cells. So these are the kind of disadvantages that makes to make to develop a new kind of novel method so that all disadvantage we can neglect it. So these are our proposal to study neuropathic corneal pain. So I'm using this lateral anatomy step, and when after finding the long cylinder, I am not ligating it. I'm just pulling it with this force, this pressure, this duration, and this direction, and there's no severance, and also it's kind of easy because holding the cylinder with iris spatula is easy for 10 seconds as compared to ligate the nerve. So I developed these kind of novel method which I call pull nerve model of neuropathic corneal pain. So by holding the ciliary nerve in rodents, which is a modified aspect in ciliary nerve surgery, we generated a unique model named pull nerve to explore the exact NCP process has involved without damaging any kind of corneal layers. So what are my figure panels? So after these, I prepare my manuscript and some figure panels which I want to share with you. So the first figure I made is about the schematic, which showing the origin and insertion of the long ciliary nerve. It's originated from the trigeminal ganglion from the its branch ophthalmic nerve, and finally inserted in the corneal nerves. So these are kind of schematic for the long ciliary nerve, and I am pulling it with some kind of spatula. So these are my parameters of the force, pressure, duration, and direction about the pull nerve. And second one is about some surgical brief aspect, like I have exposed lateral fornix and prepared some soft tissue and connective tissues and hold the ciliary nerve. and finally close the skin. And third one is about the schematic for the behavior test. I use two behavior tests. Which one is the mechanical, which we call the one-way filament, and second is the chemical drop, which we call eye wiping test. So I compare my pull nerve and normal control model from D-1 to D14. So I found this type of reading, and these are for the number of IVA for the chemical eye drop, and I found this type of reading. These are the figure legends for the figure 1, and these are the figure panel 2. So here are the kind of schematic for doing whole experiment. From D-1, I did the both behavior tests, mechanical and chemical, and D0 is surgical day, and the days T1, 3, 5, 7, 14 is the behavior test day, and finally sacrifice the mice on day 15. So these are the kind of protocol for doing the one filament. I use calibrated some kind of one filament between 0.008 to 0.16 gram, and I applied for the duration of 5 seconds in the center of the eye. If the mice blink their eye within 5 seconds, that means it's positive response. I did it 5 times with for continuing. I found 3 times blinking out of 5. Then it is a kind of a symbol of for the positive. So I prepared this kind of data after doing this protocol, and I found there is significant changes in the pull transaction, and they're less significant compared to the pull transaction, while also sham shows some kind of significant value in the between the days. So when I have underwent some literature survey, what I found are like as compared to the chemical test I had, you can see we cannot find any significant changes chemical sham model. So I found that in the mechanical one frame test, the area we have a confined area. We are using the filament to a confined central part. So that activate the more number of nociceptive of corneal cells. So that means um, after having some kind of surgery without holding the nerve or touching the nerve, there's a kind of effect for in the sham model. While for the chemical test, chemical is a kind of what I use 2M NaCl solution for a volume 10 microliter for 10 seconds, and only the response from the 4 limb I consider within 30 seconds and prepare this graph. So the after when I drop it, it cover the whole corneal cell, but it's like surface area is more as compared to the mechanical, so the effect is less as compared to the mechanical. So that's why the sham didn't show any kind of significant value. These are the figure legends for figure panel 2. And what is the figure 3? I prepared these are the schematic of how when pain stimulus in the cornea, how transmitted to the brain via the long cylinder which I am pulling. And abnormal response mean the allodynia and hyperalgesia. The graph I show you, I got that type of behavior responses and how it involves the thalamus. And finally, through peripheral and central sensitization, there is a kind of a different changes in the brain. And second part is about the perceived sensation and stimulus intensity graph. I here show you what is the allodynia and hyperalgesia as compared to the normal. And S1 is the pain and stimulus value at 0, and S3 is the threshold value. So these are different between inner cause and noxious value, and these are the ultimate pain sensation. So these are the complete overall aspect of the perceived sensation stimulus graph related with the mechanical and chemical behavior test. Third, I calculated by myself, like in we did a perceived sensation and chemical intensity of for assessing the quality aspect of the neuropathic corneal pain. The graph I showed you is about the quantity aspect. So these are the kind of qualitative aspect. I make some um, um, values like in the 0.5, M, 1, and 2, and 3. So these value, I prepare the solution in different concentration. And what I found, there's like when we uh, assess it as the imaginary allodynia area, and we assess the hyperalgesia value. So from like till the values 1.5, there is not very much significant changes, but when I increase the concentration, so it becomes significant, shows the significant value between the three model full transaction, full nerve, and normal control model. So I plotted this as a apologesia value and plotted this area as a allodynia value. So the D value, we did some linear regression method of the alpha value, what we found. So we found more alpha value in our full transaction and full normal model and normal control, and both these model are greater alpha value as compared to the normal control. And we use Stevens power law to use to make this alpha value. So these are the Stevens power law formula. I calculated my alpha value using this power law of exponent, and we found this kind of changes in our uh, full transaction and normal control model. So these are the figure legend, and the figure 4. Here I want to show you about the anatomical position and the dissection of the ciliary nerve. So I divided the position of the ciliary nerve in two parts. One is nasal side toward the nose, and one is temporal side toward the temporal. And these are kind of ciliary nerve. So I hold it with the iris spatula. The diameter of the spatula is around 0.5 mm. So we can consider skull bar according to these. So I hold it for 10 seconds with the desired parameter I found. And B part is that I dissected the nerve on day 1. So these are the absolator part and these are the contralator part. And these are the pull nerve region which I hold here with the spatula. So I calculated the temporal side width and nasal width and total length really. So I found out the elongated and thickened in the size of the ciliary nerve for ipsilateral side as compared to the contralateral side. And ipsilateral side have increased temporal and nasal width. And total length of the ciliary nerve for ipsilateral is also increased as compared to the contralateral side. So we conclude that the pull nerve region, a pull nerve model have thickened and elongated size as compared to the contralateral part, which is unpulled. These are the figure legends for figure 4. And for figure 5, we plan to check the downward pathway and upward pathway. For downward pathway, while the insertion of the ciliary nerve is cornea, so we plan to check the corneal layer through HN staining what happenings after our full model. So this in the normal cornea, we can see this is the epithelial layer, this is stromal layer, and this is the endothelial layer. So after pulling and when I analyzed through HN staining, so we found like in same control, there is not very much significant, but still some kind of significant activity we can see. But the major, the focus is on pull nerve. So we found there's a detachment of epithelial layer in the pull nerve model. So what I found is a kind of exfoliation due to the erosion. So in our pull nerve, we found exfoliation of the epithelial layer, which is attached to the stromal in normal control model. While in full transaction, we see the complete loss of epithelial. These I call epithelial remnants. So we found some kind of epithelial remnants in full transaction model. Then we plan to analyze the epithelial thickness, stromal thickness, endothelial, and relative thickness. So we found a significant changes in epithelial and stromal thickness, and the more epithelial damage is in the full transaction model, while the more stromal changes in the full transaction model. And endothelial thickness didn't have any significant change in all the four model. And finally, the relative thickness percentage I calculated according to the layer is shown here. These are the figure legend for figure 5. And finally, for figure 6 is a kind of upward pathway, which is the trigeminal ganglion. So we check some kind of neuronal satellite gland activity and Schwann cell activity through HNE staining. So here you can see this one is the neuronal cell body, and surrounding it the smaller one is the satellite glial cells, while the lines is the nerve fibers, and surrounding the cells is the Schwann cell. So I check it, the total number of neuron cells is a significant changes in the pull nerve and full transaction, while sham do not have any changes. And I also check it, the total number of ciliary glial cells also changes in the pull nerve and full transaction model and sham do not have any change, while Shivan cell didn't have any significant changes between all these three model. These are the figure legend for figure 6. And these are the I made this table which I shown you in the for very initial slides about the advantage and disadvantage of the existing current neuropathic model. Now the supplementary figures, I made the supplementary figure one, the overall step of the protocol, what I did for in making my pulmonary model. Make it and show the first step and the second step, third, fourth, and fifth. Second, I check the quantitative analysis of mechanical for contralateralized, so between full transaction, pulled, and sham. So I didn't find any significant value between the days for all three models. Third, I made the quantitative analysis of the chemical corneal test, the second behavior test, and I also didn't find any significant changes on the contralateral eye for all these models between the days. And four, I made the changes in the histological I found in the cornea, like I showed the exfoliation in the pulmonary model, so it's a kind of detachment. And when the damaged cornea become thicker, I explained this. And there's a vacuolation, the remnant of vacuoles, which I found in the full transaction model, and also there's the loss of epithelia, which I named epithelial remnants, the traces of epithelial remnant, and these are the findings related with these. These are the histological changes I found. And according to that, I made the table in four model between the exfoliation, vacuolation, and epithelial remnants. So there's a kind of presence of vacuolation and epithelial remnants in the full transaction model, while full nerve have only exfoliation value. So these are the table related with the grading in the corneal areas of neuropathic corneal pain. So thank you. This is the end of my presentation. Thank you. If you guys have any questions, please give your valuable feedbacks. Thank you so much for listening my whole presentation. Thank you.